Good morning, everyone. Welcome to this expert clinic on linking social protection, employment, and economic inclusion in the times of COVID-19 and beyond. I'm Aude de Montesquieu from the Partnership for Economic Inclusion, and I'm very happy to welcome a team of experts online. We have some people you can already see online, and then we'll be joined throughout the session by a lot of you participants who are also experts in this subject matter. But first, I wanted to introduce those who are on video with us today. We have Frédéric Leprince, who's Director for European and International Relations and Cooperation at the National Family Benefit Fund, La Caisse des Allocations Familiales, CNAF, in France. We have Laura Alphas, who is the Director for Social Protection Program at the Women in Informal Employment, Globalizing and Organizing organization known as WIGO. We have Marlo Popes, who's project coordinator at BRAC's Ultra Pro Graduation Initiative, and Marlo's been particularly involved in the BRAC technical assistance to the government of Philippines and other projects. We should be joined in the minutes to come by Samir, who works on providing ADB support in areas of social protection. And then we have Thierry Fiquet, who is the Development and Technical Advisor on Labor and Employment for Socieux, EU facility on social protection, labor and employment. And who's also had a long career at the French Public Employment Service called Pôle Emploi. So welcome everyone. This session is co-hosted by the Social Protection for Employment community on socialprotection.org. The Social Protection for Employment community is also known as by its acronym SPEC, and is represented here by Fazli, who's joined into this session. SPEC is a community of practice that facilitates exchange of knowledge on linking social protection to employment programs. And so on behalf of both of us, both of our organizations, I'd like to welcome you. This expert clinic is basically designed to be a sort of bona fide Q&A, really a peer-to-peer exchange. We've got some kind of guiding questions, but the idea for all of us is to be on the spot, answering and discussing questions that are submitted to us through Slido. Roberta has provided the link to Slido in the chat. You were able to see it. Please let us know in case you need technical help to access the Slido. To get us started, why did we think this session was important? As we all know, COVID-19 is accentuating the risks that very poor people and very vulnerable people are facing in many different ways. First, the immediate health risk, but also the pandemic and the associated lockdowns have obviously had devastating impacts on the economic well-being of very poor people. And these impacts have motivated governments in the first phase of response to use social protection and social assistance measures as an immediate response. In the second phase of response, in the medium to longer term, we're interested in understanding if and how can employment and economic inclusion programs contribute to helping very poor and vulnerable people get back on track, restore livelihoods in the wake of the pandemic. Can these employment and social and economic inclusion programs help mitigate the impacts of the pandemic and help very poor people move towards economic recoveries? In this session, we'll be asking questions around the opportunities and challenges of linking employment and economic inclusion programs with social protection programs in response to COVID. And we'll be specifically asking experts for really concrete country level examples of how things are working in their country or the country they're working in, and what are the specific challenges in their context and what are some of the opportunities. I want us to move to the Slido link. Martina has just provided it in the Zoom chat, so that we look together at the questions we've received. Some are posed by the experts themselves to one another, and then we've got some newer questions which were arriving even early this morning. Basically, if we look at the questions, there are some very high-level questions on the visions and the objectives for linking economic inclusion programs and employment programs to social protection. What are the opportunities of doing that? What's the vision of doing that in this pandemic phase? And then we have some more specific questions around design and delivery adaptations, specifically to COVID. We have a series of questions around adapting to urban informal economies, um, uh, some questions around gender, some questions around the use of technology to respond to COVID, a few series, Marlo, get ready, a few series of questions around specifically the graduation approach and how BRAC is using it. And some questions on sustainability of economic inclusion and employment programs in times of COVID. So please, everyone, continue to populate the Slido with your questions. Be aware that if we are not able to respond to some of your questions now, we will respond to them later and share the link in a Google Doc. So please, don't be discouraged by the fact that the time is running out. Continue posing your questions, and we will do our best to answer them. Without further ado, I want again to welcome all of you. Welcome, Samir. I see that you've logged in. We're very happy to have you here again. Samir, Marlo, Laura, Frederic, and Thierry, the floor is over to you. I'll start with a question. Specifically, to Samir to start with, I'd like to ask you, specifically in your region, what are some of the innovations in social protection in the wake of COVID? Can you give some specific examples around how economic and employment programs are being used as medium to long-term recovery programming in the face of COVID? And what are some of the key challenges and opportunities in your region?
Thank you, Aude. Thank you for, you can hear me all right, I think, right? So, okay, great. So thanks a lot for this. This is an exciting clinic, and I'm glad we're all here. I'm sorry it was a bit of an issue this morning, but anyway, thanks for that question. There is a lot of innovation that's taking place in Asia and Pacific. I'm at the Asian Development Bank, and we've been looking at, so for the last 6-8 months, ADB has provided a lot of support to our countries in our region in the wake of COVID-19. And one area where we saw, of course, the income support for folks who have been left out of their jobs is a key element of our support to our countries. And you see that you see that what has happened is countries that have had good data management system, good sort of digital payment system in place, were able to scale up quickly, able to include more beneficiaries. That was it. They were able to do that rather quickly. But the others who didn't have that struggled a bit in terms of even identifying the beneficiaries. So that's something that we saw right off the bat. So there, what has happened is that there has been an impetus towards using more digital technology for payment systems, even for registration, all of that. So now there's a bit of a push for that. And we see this in some of the bigger countries like Indonesia. Philippines already has a very good system in place because of the Pantawid program, and also same in Indonesia as well with PKH, but there was a lot of people that were left out. So there have been improvements in that direction. So the innovation has come mostly from leveraging technology to improve coverage. So that's happened, and great news. I hope we continue moving into that direction. In terms of the labor market, so the link between the social protection and labor market component, as you know, with this, there are other folks on this call who are experts on sort of public works programs, but some of the things that we have seen is that the linking social protection with labor market programs like public works or something along those lines, where employment guarantee, something like that tends to work well. But of course, it's a relatively complex topic and depends on the country context, what makes most sense. But in the wake of COVID-19, I think all I can say is that in social protection itself, without sort of getting into the labor market programs so much, there has been a lot of new effort, new innovation taking place. Now, I think the next generation, the next set of problems that we need to work on is how do we link those two well in the wake of a disaster. I think I will leave it at that. Over to you, Aude.
Thank you so much, Samir, and thanks for making the link to the labor market programs. We'll follow up with questions on that later. But now I'd like to turn to Laura. We got a question specifically on the urban poor who are mostly living in informal economies. We have someone on the slide here asking, how should we think about economic inclusion in relation to this very vulnerable group? Where and how can social protection, employment and economic inclusion programs play a role? So Laura, over to you for questions on the very informal, in particular urban client segments.
Thanks, Aude. I think first to point out that many of the urban informally employed are not the very, very poor. So they actually aren't the targets of, the graduation programs, and they're not the targets of social assistance usually, which is partly why there's been this big problem in trying to reach them. They're not the usual targets. They're not poor enough. So this has really challenged us to think about the importance of social protection for those who aren't just very poor, that actually there is an important role for social protection for able-bodied people of working age. And so I think that is a kind of broader point that I need to make. I think another point about urban informal employment, and it's something that we don't recognize, particularly where the focus has been on rural poverty and rural employment, which has been where a lot of the social protection focus has been, is that urban informal workers face huge negative forces against their livelihoods on a daily basis, usually coming through urban regulation and urban systems. And this is an unusual thing to think about in social protection services. Why are we talking about municipal service provision, and why are we talking about urban regulation? But it's because the kind of punitive and anti-informal employment nature of many of those urban systems actually works against economic inclusion and people's access to employment opportunities. So, for example, we've seen, despite the rhetoric of social protection and wanting to provide protection to informal workers, we've seen evictions of informal workers taking place in places like Zimbabwe and in India. We've seen harassment of migrant informal workers in South Africa by local governments. So there's a disjuncture between what's happening at the national level and what's happening at the level of municipal governments. And I think just by what we call reducing these negatives, you are actually doing something towards economic inclusion, even though it's not necessarily a policy thing. And I think that it's important to emphasize this to social protection audiences, because it's through social protection that the state is trying to provide protection. And by emphasizing the contradiction between that and what's going on at the municipal level, we can really perhaps drive a more coherent policy response that helps to reduce the negatives. And then I think the other end is emphasizing and promoting the positive forces, right? So the extension of social protection is critical. We've just finished a survey in India with the Domestic Workers Federation. We found in Bihar that almost 80% of domestic workers reported needing to take out a loan for their last health visit, one health visit. And those loans are what drives people into debt, into poverty, and forms of bonded labor. So the importance of extending social protection to working age people beyond the poverty targeted basic minimum is incredibly important as we move forward. And without that social protection, we're never going to see these informal workers moving out of almost poverty. Because it's just, you're facing so many risks, and then the urban risks are just part of that. That it's not helping people to move out unless there is some kind of protection there. And then I think that we've seen a lot of demands for financial inclusion coming out of the worker organizations we work with. Street vendors in Africa in particular are emphasizing the need for startup capital to restart their businesses, low or no interest loans, and where loans have been provided in places like India, the demand is that actually these loans should be turned into cash grants. These actually should be seen as a form of protection, and the social protection will be used to restart our businesses. And so in that way, I think you can see very clear links between social protection and economic inclusion. Access to markets is a huge problem, whether it's, reducing transport costs, establishing organization in the economic organization. The problem with being poor at the bottom end of the economy is that it's very hard to sustain the type of organization that allows you to change the market institutions, which are to be more favorable to your interests. And so I think, those kinds of factors are important, as well as supportive rather than punitive legal frameworks. And I think, again, that's that emphasis that a lot of the urban informal workforce faces a policy situation that is overall very punitive, and that just reducing and changing that could go a long way to promoting economic inclusion, along with the more protective policies like social protection. Thanks, Ord.
Thanks for bringing that policy and regulatory issue forward. Just linking to some of the comments you made about the labor market, and its barriers to entry for poor and informal people. I'd like to ask Thierry some questions that were on the Slido in terms of some people mention that there are lack of market inputs in the design of programs. What do you think are the most important things to suggest to an agency delivering economic inclusion programs? How do you design labor market? How do you get labor market actors to input into the program design? And there's a follow-on question from the Slido, which I'd like to address to Samir and maybe some others if you want to chime in. What are the most successful labor market interventions for informal economies? Have you seen things that are working well in the regions you're working in? And in case you want to develop this idea of public works in the face of COVID, public works as one of element of COVID response, please also do comment on that, because we're getting a suite of questions right now on Slido around how to use and design public works as a COVID response. Thanks a lot. Over to you, Thierry.
Thank you. Yes, about the inputs of the labor market for the whole social protection scheme, and more widely about the development and strategy plan, national plan for the economic recovery. You asked me what should be maybe the priorities. The first one, and shared with our partners from ILO, would surely to link the national employment policies to the whole social protection scheme, but moreover, like I said, with a large strategy. With Socioplus, we saw it those last month and weeks during our missions. We saw it in Cameroon. That was great initiatives to make a partnership between different ministries and stakeholders. In Indonesia, Uganda, Ecuador, this is a main thing, not just to separate the different subjects between social protection, employment, and moreover, economic concerns. Mostly, we observe that the subject is how we can provide information to adapt a social protection policy. I will talk about the labor market information system that becomes the first priority everywhere. We were last week with many partner countries in Rwanda, Uganda, Cambodia, Kenya, working with our Swedish partners to implement and develop LMI system. This is the first priority to make the good evaluation of the situation and just to make good decisions and good investments on the labor market. that calls about VAT, that calls about protection and safe on the workplaces. Sharing information between social protection organizations and those from labor and employment is the key to gain mostly in reactivity and to adapt responses to the needs and the future needs. I think that the crisis enlightened that separate the two axes is just nonsense. And moreover, active labor market policies are more and more and very speedily to define whom, for whom, and how. And more than big laws or establishing new labor laws, new codes, the period may be dedicated to different concrete experimentations with small groups of people, small groups of workers, employers, different institutions involved in the social protection and labor employment world. We saw it in Ivory Coast, for instance. First of all, our mission was mainly oriented to the ministry and to train the people in the Ministry of Labor. At the end of the missions, or the 3 missions, we had around the table and in the sessions and actions of training, more than 10 different institutions. And the Ivory Coast took the decision to enlarge the thing, and we could cover different issues and main issues as labor for women, vocational and educational training, youth employment, obviously, and people with disabilities on the social protection, so insurance and assistance way, and for employment too. And we thought that we're engaged in this reflection, the great theme of OSH, occupational safety and health, where in Europe, for example, have been developed very concrete recommendations and guidelines. Socioplus is going to deliver, and I will share all those information in the chat or in the Google Doc, I think, of this session. And in the future weeks, we will have 2 delivery, one about LMI, which is already available, and the second one about the study about what has been done in European Union in social protection and labor and employment to face the crisis.
Thanks a lot, Thierry. Thanks for this reminder, and please send the links to the documents and the events you're hosting in the chat, and we will also promote them online later. Lisa, I see that you're online. Lisa from DFAT. Thanks a lot for posing a question. I just wanted to recognize a question from you on linking on designing employment programs in times when there's a lack of employment opportunities and what can be done from there. And I just wanted to check in, sorry for putting you on the spot, but do you want to chime in on that point? Please do so if you want to, and otherwise I'll move to the next question from the Slido.
Sure, thanks Odd. Yes, and I definitely don't have any of the answers here. So yeah, I've got a question around it's just, I mean, this is such a tricky space, social protection and employment in normal times. And obviously we've been doing a lot of work on it, and we've got the SPEC community that's trying to learn from each other. But in normal times before COVID, this was still like so hard. There was no easy formula in terms of creating, I guess not creating jobs, but linking people on social protection programs into employment. And I was just wondering if people's thoughts around whether they see this time as a bit of an opportunity. I mean, given that people in my organization, Department of Foreign Affairs and Trade in Australia, are now talking about social protection in a way they've never talked about it before. And increasingly talking about the recovery phase and linking to livelihoods. And yeah, I'm just keen to hear what people think about that, whether we can really use this as an opportunity to get a greater focus on something which, as we all know, is so very important, or whether it's just become even more difficult for us in an already very difficult space. But anyway, keen to hear people's views on that. Thank you.
Thanks. Does anyone want to chime in from the public? Thank you very much, Lisa. I see there are different people from GIZ, Mito from ILO, others. I mean, please feel free, Celine, please feel free to chime in if you want to now. Otherwise, I'll move to our next question. Just unmute yourself if you want to chime in.
Aude, I had a point I wanted to make. Is that okay?
Yes, please, Samir.
So, you know, on the informal sector, one of the things that I kind of wanted to quickly bring into this discussion is that we looked at Cambodia and Philippines in the wake of COVID. And for those of you who know what's happening in Asia, Cambodia, in terms of COVID, not hugely impacted, and lockdown wasn't as stringent. Philippines, the lockdown was very stringent. It has been stringent. So I did some analysis on looking at the labor reallocation, right? Usually during crises, when there's a crisis in a sector or an economic crisis, folks move out of one sector to another. So when we did this type of analysis in Cambodia and the Philippines, we see that in the Philippines, the labor reallocation didn't really take place as it normally does. So our model estimates showed that people would be moving from some of the industry, manufacturing sector to agriculture, but we didn't really see that because they couldn't really travel out of cities into rural areas. But in Cambodia, we saw a lot more of that. So what it means is that in Cambodia, a lot of folks have entered into your informal employment, your wholesale retail trade because of the crisis. But in Philippines, we didn't see as much of that. So there's a bit of that difference in terms of the stringency of lockdown and labor reallocation across sectors. Because of labor reallocation, you also see that you can expect increase in informal employment or vulnerable employment. You see a lot of that. So there's a bit of a difference in terms of the lockdown. The other thing in the Philippines is that because the data is so good that we could actually compare. The model estimates were based on ILO's data from ILO statistics that we used, but then comparing it to the labor force surveys, you see that actually the impact was much harsher on the Philippines than the model estimates showed. So really, I mean, I don't think we really have a good handle on what is the real impact. And my worry actually is that this crisis has increased the share of vulnerable employment, people in the informal employment. It must have increased because of the numbers we are seeing, at least in these two countries. Just that, I think over to you, Aude.
Thank you so much, Samir. And I think this provides a nice segue into one of the questions I wanted to pose specifically to Frédéric on the increased vulnerabilities of women in the times of the pandemic. And Frédéric, one of the questions that is posed on the Slido to you from Thierry is, despite the efforts to ensure equity in the day-to-day care of children, this role is still traditionally and even culturally devolved to women. Does this have an accelerating effect on the crisis for mothers and other caretakers, in particularly women? Frédéric, over to you on this question of the specific gender impacts of the COVID pandemic and the link to the employment opportunities for women.
Thank you, Aude, and thank you, Fike. Good morning to everybody. Well, in general, in most of the countries, schools and childcare facilities were closed, and well, when they exist. At the same time, it was very difficult to ask for grandparents for help because it was risky for them with the COVID. So fathers and mothers had to find solutions while continuing to work from home. They had to take care of the children. But as you said, this role is traditionally devolved on women. And in fact, the crisis has really increased unpaid and care burden for women. So most part of women could reconcile work family and work life and family life, but they were very exhausted, more exhausted than usually. And in France, for example, when it wasn't possible for parents to work from home because and they had to take care for the children, there were specific sick leave policy, and sickness benefits were allowed to the parents. So it was easier for them. But we could observe that most part of the time when parents have children, there's a woman, there's a mother who asks for it, who asks for the seat. What else? Childminder who had lost the job, it was a problem for them. But we had an allowance of 80% of the salary in order that they can live. And the parents, employers could give them 20% of the salary. Most part of the parents gave them. And also I wanted to say that in France, we had emergency childcare facilities which stayed open when for essential workers. And my organization, National Family Allowances Fund, organized very quickly the possibility for these parents to find a childcare facility near their home or near their job. And so they could go on working, and they had a solution. They had a solution for their children. So it was very useful. And so the childcare was a real problem for most of the parents, and above all for the mothers. And I think that stakeholders suddenly take conscience that it was a problem for parents, because most part of the time, parents organize themselves with the grandparents, with a solution. In France, we are really lucky because we have a good coverage by childcare, but it could be better. And so stakeholders took conscience that it was a real problem, and that if they want to have the job of the woman, who are a lot of essential workers in the hospital, in the care for elderly people, they had to provide a solution. They had to provide childcare. And I wanted to know that most part of time in the international organization, this problem is not analyzed. It doesn't take part of social protection, but indeed it takes part. It's a very important part of social protection. And so it would be really interesting that when we speak about employment, when we speak about women, well, we can think about this problem too, and we can have analyses and statistics about childcare, because it's not only something which is hidden and for parents who have to make it with that.
Thank you, Frédérique. Definitely resonates the challenges of childcare and remote work. You probably hear it behind me. Thanks. I think this is a very important point, and I'd like to bounce back on this question to address a question to Marlo. For example, in the programs that are supported by BRAC, are you taking into account the economic inclusion programs? Are you doing something about childcare and other social support services that can help women in particular access economic opportunities? Is that something you specifically designed for? And I'm asking this question to Marlo now, but others, please feel free to jump in on this question and come in with your comments. Thank you.
Hi, Odd. Hi, everyone. Thank you for the question. BRAC graduation actually, all the programs to take into consideration the care burden of female participants, and have in some instances where feasible and viable, encourage group livelihoods. For instance, in the case of Kenya, where 3 women rotate support a shared enterprise, typically it's a livestock, and caring for their children and those of the other business partners. So they're formed into group or peer livelihood. Additionally, all the graduation programs that we support, we have a localized market assessment that should always be attuned to gender dynamics and social norms within the communities, and are able to recommend home-based livelihoods, basically for caregivers that if is deemed appropriate and viable. As in the case of the case in Egypt, where a number of vendor options were home-based or very near participant homes, given mobility constraints for women, especially female-headed households caring for children. That is also the same case here in the Philippines, that most of the livelihoods that we provided are home-based. And also to ensuring children are enrolled and attending school is also encouraged within the graduation programs, as it is in the case of the Philippines, where we cater to the Pantawid Pamilya program participants are also required to enroll their kids and to take care of them, which is also a graduation criteria, no? Which can serve to reduce the care burden for the out-of-school children and reduce instances of child labors. So I think those are the three key interventions pertaining to our support on the child care and other social support services. So I think back to you, Odd.
Thank you so much. Thank you so much, Malo. Do other people want to reflect on this idea of the other social support services that are needed to help women in particular access the labor market and self-employment opportunities? Laura, please, yeah.
Yeah, really just to emphasize the issue of childcare as being so critical. We have a longitudinal survey running in South Africa, the National Income Dynamics Coronavirus Rapid Mobile Survey. And the Wave 2 data is out. And really the care burden, it shows very clearly how women have had to take on the impact of the closed schools and the closed ECD centers. And how that's affected the amount of time they can spend on income earning activities. So just to say to Frederique's sort of call for data, I think that data in South Africa has been very clear on what's happened to women's incomes in both the formal and the informal economy. And I also think part of that is about what's happened to the early childhood development workforce as well. The latest round of reports has talked about how decimated the ECD workforce has become because of the closure of a lot of the privately run creches or those subsidized by the government. And so in thinking about the childcare crisis, I think it's not only an issue of childcare for women needing to access the labour market. We also need to think about, the childcare workforce as well. And perhaps that's one way that we can link up the services and employment. I know UN Women always talk about the triple dividend that comes from building up your childcare workforce. Because you're not only allowing women to access the labour market, but you're also potentially creating employment for women as well. And in South Africa's expanded public works program, it's one of the few in the world where, childcare services are included as part of the public works component. So I just wanted to mention that.
Thank you very much, Laura. From the Slido, we have a question on another form of vulnerability, which is about people with disabilities. And the question is, in many countries, work opportunities for people with disabilities are also limited to specific work opportunities, for example, blind people working as masseurs, etc. Given the low level of education, it's sometimes a challenge for them to learn new skills. How can we address the specific situation of people with disabilities? Ask the question on Slido. Does someone want to chime in on the specific question of how to help people with disabilities access the labor market and the best productive activities in these times of pandemic, given their extra vulnerability? Thanks.
Yes, I would like to testimony of the different expertise missions we implemented those last month. And you are right that the people with disabilities was in the center of our preoccupations. For instance, we had missions still ongoing in different countries, Ivory Coast, Peru, the Republic of Kyrgyzstan, and facing the impossibility for us to deliver and for them to have on-site missions, whereas they could sustain their projects, our colleagues went on in a very voluntary way. And the first thing, and maybe linked to the gender and employment for women, is the great theme of the digitalization. and access to the vocational training. This is a great subject because this is not only a subject of a technical subject. It may be an investment one. And what is good for women and people with disabilities is good for everyone. And I agree that when we think about people with disabilities, we always think about the blind people and seeing handicaps, but disabilities. But this is not for 80% of the population of the people with disabilities. No one can see the disabilities, and in a context of crisis, the vulnerable people are more vulnerable than ever. And that was a very good news for us to know that our different partners in the world were really involved in that thing and wanted to make new national employment policies very inclusive and more than before the crisis. I wanted to add this testimony about the PWD subject.
Thank you very much. Does anyone else want to chime in? There are many people online. Please feel free to chime in now if you'd like to. Otherwise, gone. Otherwise, let me turn to Marlo. We have many questions on graduation specifically and other graduation type, multidimensional economic inclusion programs. I'm going to summarize a bunch of them together. The first is, how are you seeing at BRAC, how are you seeing economic inclusion programming for very poor people being implemented in conjunction with social protection and employment programs as a response to COVID in the medium to long term? And what do you think are the challenges and opportunities of using this type of program in response to COVID? And there are questions specifically, do you have country examples around how these programs are being implemented? I know that you're working in the Philippines. And then questions around, what do you think of the sustainability of this approach? So I've summarized quite a bunch here, but basically it's around the vision for economic inclusion programming in response to COVID, and what do you think the prospects of sustainability are, just to kind of summarize it here. Thanks, Marlo, over to you.
Yeah, thank you so much, Odd, for summarizing the questions. So actually, we view graduation as playing a critical role in building resilience among communities, in promoting long-term and large-scale recovery. We have seen holistic graduation programs to be uniquely useful and powerful tools in reknitting social fabric in recovery and for resilience. Actually, graduation programs can provide immediate coping mechanisms and plan for recovery by building and diversifying household sources of income and awareness to prepare for and respond to economic shocks such as the COVID-19 pandemic. We understand that government social protection programs to be a central modality for resilience building and recovery strategies by offering cash and other social or health and human capital that can be focused to stimulate local economies for inclusive development. However, strong social safety nets will help countries build back inclusive development. These crises present an opportunity to actually create more sustainable, inclusive resilience and equitable system. Actually, in terms of cost, for it to be integrating as a COVID-19 response, graduation can be a resource-intensive investment at first glance, and it can appear to be more expensive than it actually is in practice. As there are often formal social protection systems such as cash transfers and public works, national health insurance schemes already in place and budgeted for graduation can be leveraged. So while these are designed to meet the immediate needs of vulnerable populations, there are also other initiatives, particularly in agricultural and rural development, that don't target the most vulnerable and could widen their scope to provide for more long-term needs of the extreme poor. So building on what already exists is the most strategic and cost-effective investments that governments can make to secure long-term benefits for the extreme poor and a pathway to scale. So in this view, I think the marginal additional cost is much more modest. In terms of adaptation of graduation to the COVID-19 response, BRAC is swiftly adapting to address the increasing vulnerability of those living in extreme poverty and ensuring their basic needs are met during the pandemic and its aftermath. So not just during the pandemic, but we are also already preparing for moving back to being the so-called new normal. Though most of our regular graduation activities have been suspended across geographies for existing programs, the graduation support staff around the world continue to support participant households to help meet their basic needs. So what we do is that we continue to support households to access available government services. We provide cash support, consumption stipends, and basically something or seeds or livelihoods to ensure food security. Sharing information resources from governments on health, hygiene, sanitation, and tips for prevention like basic proper hand washing, as well as engaging in remote phone-based coaching and advising on livelihood diversification, savings, and investments. So even though we stopped our field face-to-face operations, we utilized technology to still reach out to the program participants, to beneficiaries who still needs the help that they need, that they can get most especially during the pandemic. So actually, our swift adaptations have resulted in participants' ability to adapt and continue generating income both in the Philippines and our flagship program in Bangladesh. So as an example, right now in the Philippines, based on an assessment that we conducted in July 2020, it showed that 99% of our graduation participants reported a high understanding of hygiene awareness. And we also we were able to track down if they were able to receive cash or any incentive from the government. And insofar as the assessment is concerned, 96% received cash from the national government, and at least 2/3 continued income generation even during lockdown by having livelihoods designed to be easily adaptable and shock resistant. So along the way during the pandemic, we were quick to devise new ways on how to reach out to our participants. No? So basically, we provided remote coaching using mobile phones. We enhanced coordination with local governments because we also would want to update the local governments on what is happening on the beneficiaries, especially on the extreme poor. We delivered additional training on livelihoods risk management because, as I've said, we are not only giving them assistance during this time of crisis, but also to prepare them to move forward into the new normal. And basically, they are receiving cash right now, cash assistance from the government. So we would want to teach them on how to invest the money that they get from the government into sustainable livelihoods, so that whenever they are already, if the lockdowns are lifted or if there's an extended lockdown, then they have something for consumption or something to spend on during the prolonged lockdown. And other than that, we also provided additional supports to group livelihoods. And as a matter of fact, we created booklets to reinforce messages on life skills and business training topics, because as I've said, we decreased the number of face-to-face meetings. So we printed booklets, self-guide booklets that we distributed to the participants so that they can, from time to time, read on certain topics, or if they want to review the topics that were discussed.
Thank you so much, Marlo. Thank you. I'd like to give an opportunity to Laura to come in on this, to talk about how economic inclusion programs can be one strategy for rejiggering the livelihoods of very poor people or poor people in the informal economy. And then just a heads up, Samir, it will be over to you right after that. In particular, comments, if you can, on how you're using technology in economic inclusion programming. So first over to you, Laura, and then Samir.
Thanks, Ord. I mean, I think just first of all to say that I think graduation programs and those kind of economic inclusion support measures are important because they help to sustain and advance self-employment. And I know that that might be a controversial thing to say because we tend to consider wage employment as perhaps a more secure, and that's really where people should be moving to. But, you know, in places like India and within the informal economy, self-employment is actually seen as more independent and likely to get you better earnings than the really exploitative forms of wage employment that many women are in. So many domestic workers, for example, work towards becoming self-employed because the conditions of employment are better for them. And I think that interventions which help to sustain people in self-employment are therefore also important. But I guess the question is always, what are people graduating into? And that's really the key question at the moment. We're dealing with, you know, all sorts of structural economic factors that are going to push against business people at the bottom of the pyramid. And there I wonder if, you know, we have to look beyond graduation and those kind of sort of focused on the individual or the group, and look at kind of state policies that are going to help the self-employed. So if we're looking at garment workers, you know, what are the procurement policies around personal protective equipment? Can we, you know, can the state be outsourcing that to garment workers in their own homes? What are we doing around market access policies? So I think that there's a whole lot of work, you know, further that needs to be done to build on what graduation can do, and looking at the structural exclusion from the economy. And that's not to say that things like public works programs and, you know, pushing people into wage, you know, programs to support people into wage employment are not important. But I do think it's important to understand that the informal economy is split between those in wage employment, like domestic workers, and those who are self-employed, and that we need both. I know that a lot of domestic workers in South Africa and India, for example, are saying, well, what now? You know, we are waged workers. What kind of employment guarantees are they going to be for us? And so those different types of workers might need different types of interventions. Thanks, Lord.
Thank you. Recognizing we only have 7 minutes before the end, Samir, I'd like to move over to your response and also ask a question we've been posed on Slido. In your region, is there a particular country that really stands out in terms of how it's linked social protection and employment and economic inclusion programs as a COVID response? So while you respond on the use of technology, also just if you want to highlight a particular country that stood out, please do so. Thanks a lot.
Thank you, Aude. You know, I think I agree with Lisa when she pointed out that how even before COVID, this was such a difficult thing to do. So of course things, you know, haven't gotten easier because of COVID. You know, in terms of labor market related interventions and linking up with social protection, on the formal employment side, you've got, at least in Cambodia, we saw something called wage subsidies that they used for the garment sector, because the garment sector is very important for Cambodia. Of course, they were rightly worried because of COVID that the sector would suffer. A large share of people, I think about 1 million directly employed, would be, you know, looking at a very dire situation. So they put in place something called a wage subsidy, and this we'll have to see. I mean, it has had a good impact so far. So that's the one clear example I can think of. But of course, not something that, you know, it's here. It is seen as a measure of income support. So that's one. The other one is, the other example that comes to mind is from Indonesia. Indonesia introduced something called Kartu Prakerja. It's a pre-employment card. But the pre-employment card, you know, we were just on a call with the coordinating Ministry of Economic Affairs actually a couple of weeks ago for one of the ADB projects. And there, you know, the design of Kartu Prakerja was about pre-employment. But as it turns out, it is being used to provide some kind of unemployment benefit, like unemployment insurance of sort, not insurance, but unemployment benefits. So it's been used for a different purpose than it was actually designed for, because they got a decree from the government saying, you know, from the leadership saying we need to use this program to reach to more people, because we're leaving out a lot of people in terms of getting, providing them income support. So this is something we have also seen in Indonesia. So there's a lot of experiments taking place. I think we'll have to see in the coming months how, it all adds up in terms of a sort of a body of evidence from Asia that we could actually say this is what worked, this is what didn't work, and be more concrete about it. That's all I can say at this stage without being too premature in terms of the assessment. In terms of use of technology, and just, I mean, some of the countries are already ahead, but many of you probably know already, even with Pantawid program in the Philippines, it's a big program, but actually it's not really using digital technology as you think it should. So this is an area where we are working on with the country in terms of really leveraging technology to improve the delivery, to improve the grievance mechanism. The grievance systems is not that great right now. So we are working on all of that by leveraging technology. But you go over to Indonesia, Indonesia is doing much better in that sense in terms of use of technology. So there's a bit of difference as well. So the innovation has mostly been around how do we leverage digital technology for delivering social protection more effectively. And I hope we continue pushing in this direction because it will reduce loss and we'll have a better sort of a targeting of the actual beneficiaries. I hope I covered everything with this. The one last point I wanted to make is on the health insurance in Indonesia. I think Marlo pointed out that, sort of countries like Indonesia needs to move sort of more on the insurance scheme rather than social assistance, right? So here, health insurance provides a great example because what they did was they provide a subsidy to low-income households to participate into the health insurance scheme, and that has increased the coverage. It covers a lot of people. So the missing middle is not so much missing in case of insurance. So, and this is something that is important to keep in mind. If you design it properly with some set of subsidies for low-income households and then have this insurance scheme, that's the way forward, at least on the social protection front. Over to you, Ode.
Thank you so much, Samir. This is a really, these are really interesting examples from Indonesia and Philippines in particular. Thanks a lot. We only have 2 minutes left. I want to take these 2 minutes to wrap up and say that this is not the end of the day for us. We will have a similar clinic at 7 a.m. New York time, 1 p.m. Rome, Paris, South Africa time. Today on the same topic, so please feel free to continue posing your questions, and please also note that we will be answering the questions that you submit to us in Slido. We'll continue to answer these questions and throughout the end of the week, so please don't hesitate to continue asking your questions. Just in terms of wrap up for now, I want to thank everyone for the questions. I think we heard a lot of interesting thoughts today, reminding us that these programs are not just for the poorest. We heard from Laura that many poor people were being pushed into deeper pockets of poverty right now because of the crisis and the associated lockdowns. So these employment and economic inclusion programs are necessary for much broader portions of the population than they were before. We heard that a lot of people were entering the informal economy right now, and that we didn't know yet quite how harsh the impacts were on these people are. There was a call for Frédéric for more data to better understand the impacts of the lockdowns on on poor people in general, and from Frédéric also call for data and a better understanding of how the COVID is having gender-specific impacts and how social interventions beyond employment and economic inclusion programs per se, but other social interventions like childcare, etc., can be critical to enable labor market access for women in particular. We heard about from Thierry about the need to develop adapted livelihoods for people with disability, home-based livelihoods, and other measures specifically to address the specific vulnerabilities, double vulnerabilities of people with disabilities in the times of COVID. in the time of COVID, sorry. Then we had some interesting innovations from different experts on the panel. We heard from Marlo how BRAC in particular is using remote coaching, tablet and phone-based coaching for economic inclusion programs to continue the kind of day-to-day interaction with participants in times where social interactions need to be limited. We also heard that there were interesting program adaptations on training for participants in this new normal. How do you undertake how do you develop your livelihood in this new normal setting? And then there were a lot of questions on how do you link programs, different types of programs in the times of a pandemic, and how do you ensure that coordination is effective? It's not a question that we were able to address here, but I think we'll try and do our best to answer these questions on Slido. There were several questions that popped up at the end around coordinating programs around multi-sector interventions in a time of pandemic. We'll make sure to answer those questions. So just to kind of finalize, to wrap up on this, just to say that we heard from Laura that we should not underestimate the potential for economic inclusion and self-employment programs to provide a pathway towards better economic conditions for better living conditions for poor people in these times of pandemic. There are important policies that can be put in place to help people in informal employment have better market access, better protection, even though they're in the informal sector. Samir reminded us that pre-COVID, this was already something that was very difficult to do. So it's not getting any better, but at the same time, I want to end with the positive spin that we heard from one of the participants, Lisa Hannigan from DFAT in Australia, saying that, you know, at the same time, this is difficult, but social protection and other development actors are talking about the potential of employment and economic inclusion programming in the times of COVID like they never have before. So this is also a moment for these types of programs to take on. And I want to end with this positive note, and thank you all for joining, and please continue to ask your questions on Slido, and we'll continue addressing them throughout the day. Thank you very much, everyone.
Thank you.
Thank you, Aude. Thank you, everyone.
Thank you, everyone.
Thank you, everybody. See you later.